Hey guys, I'm Dr. Jeremy.
Dr. David here from the Hunter Valley Practice.
Sprouting Health, Chiropractic, Kinesiology, and today we're going to be talking about spinal musculoskeletal related pain. Spinal musculoskeletal related pain is actually the most common reason people miss work.
Oh yeah, absolutely.
Crazy, Dr.
If you got headache, neck pain, back pain, sorry, Jeremy can't come to work.
I can talk about that, but I'm not going to. I'm going to keep concentrating on what we're here to talk about. And because it is one of the most common reasons people miss work, we want to talk about how to help you solve these issues or help you manage these issues. We know that it's also a huge cost and burden on society, and we also know that the best results in the most recent research that's been published this year, it's called a systematic review, and they look at heaps and heaps of studies. There was 96 studies or 94 studies, 96 it was I think they looked at. 44 studies they actually took and processed the data out of the studies. So heaps and heaps of data was crunched, and they worked out some really, really interesting things. Essentially, we know that the more intervention you use for musculoskeletal pain, generally you don't get as quick a results. And we know that the intervention are some things that Dave is going to be talking about in a little bit.
So, generally, people, when they have musculoskeletal spinal related pain, they go and see many therapists. They see a chiropractor, go and see a therapist, they go get a massage done, and generally these people get a pretty good result. But sometimes, if the patient's cost of care has been elongated by some unnecessary
treatment,
that's right, that can actually prolong the issues.
And some of them unnecessary treatments are,
yeah, and some of these are medication, unnecessary use of pharmaceutical products and things like that.
Yeah, absolutely. So when we're talking unnecessary use, there's circumstances where you could use these things, but by far the most overutilised and under-needed treatment of musculoskeletal pain is pharmacology and surgery. So in other words, drugs, medication and surgeries. And these studies are showing that the less of that you use and do a conservative approach like chiropractic care, we're spending way less money on and getting better outcome on spine musculoskeletal related conditions. Really, really cool.
Absolutely.
So that is the latest data off the press, guys.
One more thing I think it's quite important to point out is that the longer pain you have or the issue you have, the more likely it's going to become a chronic issue or a long-term issue, and it's going to take a much longer time for that to resolve.
Absolutely.
So don't put up with pain. If you have any questions, if you have any concerns, you're very welcome to. We would love to see you to see how we can help manage your concerns. So give us a call. We'll try our best.
And as always, we won't waste your time, money. We'll let you know if we can help straight away.
No worries.
Enjoy the rest of your day.